Welcome to another episode of Doc Martin's Case Files, where I take a fictionalised case based on the sort of patients I've seen over the last 25 years as a GP and explore the health issues around it. And today's episode is all about health anxiety. We're going to meet Maya, who's been affected by health anxiety on and off over the last 4 or 5 years, and really unpack what it is, the sort of traps that Maya falls into, the sort of approach a GP might take in trying to help her, and really what you can do about health anxiety. And then at the end, we've got the feature that I always close with, which is something completely different. What has caught my eye this week? And I want to tell you some really interesting research around statins. So very important for cholesterol and people with a heart disease problem. So maybe staying related to the heart theme, because Maya's health anxiety is all about her heart. She doesn't have heart disease, so she's not on a statin, but she worries a lot about her heart. So let's meet Maya. She comes to see me on a Monday morning, and it's to do with chest pain. So she's been getting chest pains, particularly over this weekend, and they've been causing her a lot of worry and anxiety over the weekend. Now, before we dive into how it affects Maya, let's just talk about the difference between health anxiety and being anxious about your health. It's very common and normal to get anxious about a health problem. If you've got an appointment coming up, or a scan or an operation, that's being anxious about a health problem. That's not health anxiety. It's very common as well to have physical symptoms caused by stress or caused by anxiety. And again, that's not health anxiety. Health anxiety is a very specific condition, and it's probably worth understanding it a bit like we would understand what's going on with obsessional compulsive disorder, OCD. And in fact, it's not been classed as a type of OCD, but it's been classified under the umbrella of OCD and related problems. And there's a lot of overlap, because with health anxiety, you're not just worrying, you're obsessionally worried. You obsess and obsess and obsess about the worry. And that's very similar to OCD, where obsessional thoughts are a big feature. And then, like with OCD, there might be a little ritual that you do to try and calm your anxiety. With health anxiety, the ritual, if you like, or the way you calm your anxiety is with reassurance seeking compulsion. So a real compulsion to seek reassurance and try and make sure that you know you're okay and get it checked out. So what does that mean for Maya? Well, she has been worrying about her heart all weekend. She started to get these chest pains on Saturday, and she's thought about nothing else. From the moment she started to get them until she went to sleep, from the moment she woke up on Sunday, the moment she woke up on Monday, she's been obsessing and thinking about these chest pains, worrying about the cause, worrying, is it her heart? Asking herself, should she be going to A&E? She has gone to A&E with chest pains in the past. She's been trying not to, and with help from her husband, she's managed to wait until Monday morning. She decided early on she was going to have to come on Monday morning, which is fine. But she's been thinking non-stop about them. And she has been seeking reassurance. I mean, making this appointment is perfectly okay, but it's seeking reassurance. She wants to be reassured by her doctor that she's not having a heart attack. But she's also been seeking reassurance from her husband about it. Do you think it's okay? Can I wait till Monday? Is that all right? Should I be going to A&E? Do you think it's my heart? And he's managed to help her. He struggles to understand fully what's going on in her head, but he's learning how to support her. They've got a good marriage. It's distracted her a lot. They've got 2 children, lots going on, just running the family. And that's kind of helped because she's had to do that, but she's also found it very hard to juggle everything while this running commentary of your heart could be in danger is going round in her head. Now, what do I do when I see Maya? Well, I always try to behave normally as a doctor when I see someone who I know has health anxiety. So Maya and I have known each other for a number of years, and we've talked before about her heart. Sometimes she gets palpitations, sometimes it's a feeling like she can't quite breathe properly, sometimes it's chest pain. But we've had a few appointments like this where we've needed to check her out and ending up talking about her anxiety around her heart. And I always feel there's 2 traps I could fall into, equal and opposite traps with a patient where I know they've got health anxiety. The first is that I'm too quick to dismiss their symptoms and just say, well, this is your health anxiety. And the 2 problems with that is, I could be wrong. Maybe one day she would have symptoms that actually are not anxiety and are to do with her heart, and I need to be mindful and open to that. The other is, if I'm really quick to say it's your anxiety, then I don't want Maya to feel dismissed, like I'm not taking it seriously. So I don't want to fall into that trap. But there's an opposite trap, which is where if I know someone's anxious, I might say, well, look, let's do this test because that will reassure you. Let's do this test to try and help you feel less anxious. And I end up doing more than I normally would for a patient with the same symptoms who doesn't have health anxiety. And that can be just as problematic, as we'll see. Talking about reassurance seeking through tests can be a real challenge, a real problem. So I want to try and do a middle road and try and treat the physical symptoms the same as I would anyone else. So I'm going to listen to her story. Now, these symptoms are coming from a specific place in her chest. They feel sharp. They sometimes take her breath away, but they don't really hurt when she breathes. She just goes like that sometimes. Often they're sharp and momentary, and then they're gone. Sometimes she's left with a bit of a dull ache, and then it's a little bit sore to touch and twist and move. If she's really thinks about it, I have to explore that with her. Most importantly, the pains don't hurt when she takes a deep breath, and they aren't linked with exertion. So if she walks up a hill, that's not what's bringing on the pains. They're more likely to happen when she's just sitting doing nothing, as when she's exerting herself. Now, when it comes to taking a cardiac history, listening to the story is the key thing. That's what tells us if someone's got heart-related chest pain or not. If she said to me, when I walk up the hill, I get chest pain, but when I stop, they go away, well, that's heart pain until proven otherwise. Here, just by listening, before I've examined her, before I've done any tests, I am absolutely certain it's not her heart. But I do want to ask one or two other questions. Has she had palpitations? Well, not too much on this occasion. Does she feel breathless? No, not when she's doing things, although sometimes she feels like she can't quite get enough air in, and that's a very typical symptom of overbreathing. And the most likely cause of her pain is actually overbreathing and straining these muscles that don't like being used in that way. And then you can often get chest pain when you overbreathe. I will examine her because it's important to just show I'm taking it seriously, to listen to the heart and listen to the lungs. Although actually that doesn't really give me much more information. It's the story that really matters. And then I'll say, we can be absolutely sure it's not your heart. And she'll seem relieved, but says, do you think, I was just wondering if we should have a test like an ECG. And that's always a bit of a dilemma. It's a good question. And again, I've got to try and get an even balance. There's no great harm doing an ECG. We can do it quite quickly in the surgery. So that's easy to do, and it's probably going to be normal. There's always the risk with any test that you get a false positive. So what if there's a minor abnormality on the ECG, and then I have to refer her to have more tests to prove that wasn't serious? And with health anxiety, that can really tie you in knots where you're looking for reassurance, but actually it creates more anxiety. Then other ways I could reassure her that it's not her heart would be to refer her to a cardiologist. And often, Maya hasn't often asked for that, but we have talked about that in the past. She's not asking for that today. But if I were to refer to a cardiologist, that could take months. There could be a lot of uncertainty and being left in limbo while you're getting your heart checked out. And I've got to consider the harm that might do to her. And the problem with these tests is it's sending a message that it's really important to get these things checked, even though we know they're okay. And that the test is more important than the clinical judgment about the symptoms. Now, there are many situations where actually I can't tell you what's going on until I have a test. If you say to me, are my kidneys working okay? I can't, in taking a history from you or examining you, tell you what your kidney function is. I'd need to do a kidney blood test. So there's definitely a place for tests that really add to what a doctor can say. But there are also situations like hearing about heart pain or chest pain where actually just the history taking is everything and the tests add very little. And we need to help people understand one from the other so that they're not always thinking, I've got to have a technology, a test, and that's what will reassure me. But actually I can learn to trust this doctor and trust when they know that a test would be unhelpful and when they know a test would be helpful. So I try to be as normal as possible and have that frank conversation with my patients with health anxiety. And this is where having continuity with the same doctor is so important. And sometimes waiting for the right doctor can be really helpful, even if you're anxious, because over time, Maya's been able to build up a level of trust in what I'm saying and hasn't felt dismissed. And so that helps me the next time so that she knows, what my approach will be. Now, what I want to talk about with Maya is reassurance seeking outside of the surgery and how she's managed at home over the weekend, because obsessionally thinking about it, she has wanted to seek reassurance the whole time. Mostly that's been checking with her husband. We've talked in the past about Google, and actually Maya's made some really good progress with this. She used to be onto Google straight away, and the problem with Google is you can go to Google to reassure yourself, and very quickly, if you start Googling your symptoms and you have health anxiety, you will end up finding something that really alarms you. And I sometimes say to my patients, it's a bit like gambling. If you go on a slot machine and you're an addictive gambler, the first few times you might do fine, you might even win a bit. And that's the equivalent of going onto a website that reassures you when you put your symptoms in. But just like the gambler's always tempted to put that extra coin in, play that extra round, so you're tempted to just check another website. I'll just do one more check. And all you need is one website that tells you it could be serious, and all your winnings are lost, and you're down a rabbit hole of increasing worry. So she has learned that Google is a real snare for her and managed to stay away from that, which is great. One question to explore with Maya, which we have explored over the years, is where this has come from. Why is it her heart that worries her? And there are two big reasons, I think, for Maya. One is a real sort of traumatic scar in her memory relating to her father. So her father had a really big heart attack about 5-6 years ago. And then because his heart was very weakened by it, he developed heart failure. And over a couple of years, he died being very debilitated by his heart failure and died a few years ago. And that memory of the shock of the heart attack when it happened, the fear of losing her dad at the time, and the seeing him debilitated and gradually weaken and die has left a big traumatic scar for her. So that's a big reason why she worries about her heart. The other reason is that worrying about your heart creates heart-like symptoms. So when we're anxious, our heart goes a bit faster, we might breathe a little faster, we might tend to overbreathe a bit, and that can give us chest pains. And so there's this real reinforcing loop where the more anxious she is, the more she gets physical symptoms, the more the reason there is to worry about her heart. And that is a particular challenge for her. And often for anyone with health anxiety, I'll find people will worry much more about something that gives them symptoms than about something that they don't feel. And interestingly, with Maya, a couple of years ago, she was anemic, and it was probably just due to her periods and heavy period loss. But there are serious causes of anemia. Bowel cancer is a cause of iron deficiency anemia, which is what she had. But interestingly, me telling her that she was anemic and that we ought to do some tests to check it out didn't really throw her into a spin. She was a little bit anxious about it, but she did not develop health anxiety about it. And I think that's because two reasons. One is she didn't have any symptoms related to it that were constantly reminding her of her anxiety and what she was worried about. And the second is there was no traumatic scar related to anemia or bowel cancer in her past journey, her experience. The traumatic scar that sends her brain quickly into threat mode is to do with her dad. So it's heart related that her brain just quickly goes down into threat mode, whereas other health issues, she might be a bit more anxious than other people, but not obsessionally so, which is really, really interesting. The Other thing that has happened for Maya is because she worries about heart-related symptoms, she really doesn't like feeling her heart and knowing about her heart. So when she exercises, even goes for a good walk in the countryside or walks up a hill, her heart will race, and she doesn't like that. That worries her, so she avoids it, which is a real shame because exercise is good for her mental health, and ironically, in the long term, not exercising, getting unfit, getting a little overweight, will put her at more risk of heart problems down the line. So there's lots of good reasons to try and overcome that, but that's a work in progress. The other thing that she's a bit prone to is confirmation bias. So being of Indian heritage, the same as her dad, she knows that she's at slightly higher risk of heart disease. And that has really lodged in her mind and worries her that as an Indian heritage person, she might be more prone to heart disease, which is true. But as a woman who doesn't smoke like her dad, who doesn't have diabetes like her dad, whose cholesterol is good and has normal blood pressure, that all puts her in a very low risk category despite being of Indian descent. But the confirmation bias in her brain diminishes the value of all of those pieces of evidence and tends to focus on the Indian heritage above all, and the fact that her dad had heart disease. So trying to work with her about that and confirmation bias is a key part of her making progress here. So the other question I want to ask her on this Monday morning is what maybe was going on that's caused her to become unwell this weekend. Was it general stress levels? Because the more stressed you are in general, the more likely your brain is to feel that there must be a threat around, and then it looks around for the threat, and it's used to looking for the threat. In Maya's case, there's a heart problem, so it will shoot down the heart route and start worrying about that. Or sometimes for her it's been triggered by an event. So one time it was a friend who developed heart disease, or seeing if she sort of hears of a celebrity who's had a heart attack or something, someone that she liked, that will sometimes really trigger her and set her off worrying about it. And I'm never quite sure whether the worrying causes the symptoms that then increases the worrying, or whether once she starts worrying, she notices parts of her body that didn't really have any symptoms, but then her brain sort of magnifies the tiny discomfort she has in her chest, and then it all builds up. But whichever starts it rolling, it's like an avalanche, and once it started, she's falling and tumbling down the mountain with obsessional worries and obsessional thoughts. So it's worth sometimes thinking, well, what's happened this weekend? And also trying to talk down her general level of worry and anxiety, because if she can get herself so that her nervous system is more regulated, then she can be in a better place, regardless of what her brain's thinking about her heart. And this leads to the real key thing here for someone with health anxiety is trying to help them focus on their anxiety and their health anxiety rather than the actual physical concern and worry that they have. So everything about their health anxiety will make them want to try and answer the question, is it my heart? But actually, you can never fully answer that question. She's always going to have doubt related to that because of the obsessional nature of health anxiety. And rather than focusing on the content of her worry, what we need to do is try and help her understand the context of that worry and the fact that she is engaging in obsessional health anxiety worry. So rather than over the weekend trying to say, is it my heart, have I got to go to A&E? Spending, yes, a little bit of time asking that, but then thinking, right, I know what my brain's doing now. It's engaging in this health anxiety worry. And now I need to know how to stop my brain obsessing and how to tell my brain that it's actually safe and we're okay. Now, that's very doable, but it's a challenge, and you need as much help as you can get with that. It's similar to OCD. The key thing with OCD is learning to recognize the pattern of obsessional thoughts and then changing the ritual, managing to avoid doing the ritual you normally do and finding different techniques. So she would need to identify the obsessional thoughts about her health, and instead of seeking reassurance about the content of her thoughts, have strategies that help her to manage this obsessional thinking. Now, that might be things to regulate her nervous system, like grounding techniques. It might be distraction. It might be the use of something called worry time, where you delay and postpone your worries. So she might say, well, I've decided I'm going to go and see Dr. Brunette on Monday morning, and I know that worrying about it between now and then isn't going to help. So I'm going to postpone my worry until Monday. I'm allowed to worry about it on Monday. Maybe that seems too far away. And she says, well, I'm going to postpone it until this evening. And I'm going to set aside some time when I can worry about it this evening, and maybe a similar time tomorrow. And those two worry times will allow me to help my brain feel I'm taking its worries seriously without being obsessed by it. So there are lots of techniques that you can use, but you're probably going to need help with them. And going to see a therapist can be tremendously helpful. And one of the things that frustrates me a little about Maya, if I'm really honest, is it's been very hard to persuade her to go and see a therapist. And this is a common situation, because the demands of the physical worry are so strong. You know, she would go and see a cardiologist in a heartbeat if I suggested it was a good idea. I'd have no trouble persuading her to do that, even though it would be actually a really bad thing for her health anxiety and would reinforce it in spades. Going to see a therapist to talk about the health anxiety is really tricky, because that doesn't seem to be the priority. The priority is to check that your heart's okay. And when your health anxiety comes down a bit and you're reassured about your heart, then you just get on with your life and don't think about seeing a therapist. But the irony is you've got someone who's worrying about a health problem and ignoring the very health problem that they have, or not giving it enough attention, because health anxiety is a very significant, debilitating illness that can really cause you a lot of problems. And there's a lot you can do about it. So it's a real shame not to get help. So we do talk about going to see a therapist. Sometimes I'll have spent the whole appointment reassuring Maya, checking out the physical problem, that we don't really have a lot of time to talk about health anxiety. And I'll say, look, why don't we book another appointment in a couple of weeks' time and we'll talk about your anxiety? And she'll be up for that and very happy to come and see me again to talk about her anxiety. She knows it's an issue. But what will often happen then is she'll come to see me and she'll say, I know I've booked this to talk about my anxiety, but I've been getting these palpitations and I need to know that they're okay. In other words, the physical problem steals the appointment. It sabotages it and says, no, this is more important. Working out your anxiety can wait. Right now, you've got to deal with these palpitations you've been getting. And that can be a real challenge, especially with a GP. The advantage if you're seeing a therapist is the therapist is not going to help you with your palpitations, because they're not trained that to deal with physical problems. So you're less tempted to ask them about it, whereas with a GP you will be. And this brings me to a last thing that often happens with Maya and with other patients I see with health anxiety, where when I've taken the history and reassured her that these chest pains are not a heart, and we've talked about why actually an ECG isn't required and wouldn't be helpful and might reinforce the wrong messages, and she's okay with that. So at that point, she'll then just say, so you're sure it's not my heart? And I'll say, yeah, absolutely certain it's not your heart. And then maybe we'll talk a bit about the anxiety and what we're going to do about that. And then almost inevitably, before we wrap up, she'll say, so are you sure it's not my heart? And then I've got a dilemma. I think it's the anxiety of the appointment coming to a close that often causes this. The feeling of, well, once I've left, I can't immediately come back, and then I can't get the reassurance that I need from this doctor. So what do? Do I say, yes, I'm sure it's not your heart, which might seem the kindest and certainly the quickest thing to do. But it is reinforcing the fact that it's appropriate to check for that reassurance yet again. You know, I've already said this at least once, if not twice. Does she need another reassurance? That's her doubt coming back, rather than a sort of logical need for reassurance, or because I've neglected to say that. And so sometimes I will say, I have already answered that question. And that's sometimes hard. And she'll say, yeah, but can you just answer it for me again? And sometimes I'll say the problem with answering that again is I'm reinforcing the idea that you need reassurance all the time, and I'm trying to wean you off that. And I'll sometimes even say, so I'm actually not going to answer it again, which seems quite harsh, but it does help her to understand that actually breaking this reassurance cycle is what this is all about. So it's a long-term plan. You make small gains with health anxiety, and there are other things. Another thing to consider at some point is the role of medication. There's definitely a role for, they're called antidepressants, but SSRIs are anti-anxiety medicines as much as antidepressants, and what they can do is help bring down your level of anxiety so that you can put into practice the sort of things you're working on with a therapist. But I'm not rushing to hand those out, but they have a place. And over time, hopefully, we can help shift Maya's emphasis from the content of her worry, what if it's my heart, to the pattern of her worry. I'm affected by health anxiety, and I need to learn strategies for how to deal with that and how to stop it dominating my life. So I hope that's helpful. Let's come to something completely different, which is what's caught my eye. It's an end feature on these episodes of something interesting in medicine that's completely different. And here I want to talk about some fascinating research to do with statins. So not health anxiety related, but maybe a slight theme because it is heart related. Statins are used to reduce cholesterol, and anyone who does have heart disease will almost certainly be on or have been tried on a statin. And one of the things that we know about statins is that they can cause muscle aches. It's the most common side effect with them, and the most common thing that people will tell me is causing them problems. But how often does it actually cause muscle aches? So there was a Lancet study in 2022 where they looked at randomized controlled trials and brought them all together, over 120,000 patients in total. And these were all placebo-controlled trials, so some people got a statin, some people got placebo. And in the statin group, a very high percentage, I think, 27.1% of people taking a statin reported muscle pains on the statin. But really interestingly, 26.6% of people in the placebo group also reported muscle aches. And that tells us a couple of things. One is that muscle aches are a common symptom, but also I think people knew they would have known they were in a statin trial. And I think if you know you're in a trial of a drug that might cause muscle aches, you're actually more likely to get muscle aches on the placebo. And this is a thing called nocebo, the nocebo effect, which is where if you think something's going to make you ill, it actually is more likely to make you ill. And not just that you're making it up or pretending it's a physiological effect, it makes you more likely to be ill. In the same way as the placebo effect, if you think it's going to work, it's more likely to actually work. Now, what they then did was look at the difference between the slightly higher rate in those on statins compared to placebo, and they calculated that about 1 in 15 of the people who had muscle aches on a statin, was it actually due to the statin, and the other 14 in 15 it was nothing to do with the statin, or it was the nocebo effect. So about less than 2% of people on statins genuinely get muscle aches from statins, which is a fascinatingly low number. And then another paper that was in the BMJ in 2021, they looked at, well, what about people who do get muscle aches and either stop or think about stopping their statins? What should we do with them? Well, what I do in practice is I say to patients, look, have a statin holiday, stop it for 2 to 4 weeks, and then re-challenge. See if the muscle aches go away when you're off it. And if they don't, well, then clearly they weren't caused by the statin, so you might as well go back on. And if they do go away, then let's re-challenge and see if those pains come back. And they effectively did a study like that. They had 200 patients, and they'd all had muscle aches on statins, and they then randomized them to 2-month trials of either a statin or a placebo, and they did them in sequence, so each patient actually had more than one go, and sometimes they got the placebo, sometimes the statin, and then they saw whether they reported muscle aches. And there was no significant difference between the numbers that reported muscle aches in those on the statin compared with those on the placebo. Again, potentially quite a high nocebo rate going on there. There was a small increase in the number who withdrew from the study because of severe muscle aches. Slightly more of those were in the statin group than the placebo group. So that, there is a genuine number of people who get muscle aches caused by statins, but it's much, much smaller than you would think. And encouragingly, 2/3 of the people in that study actually ended up carrying on and taking a statin. So I presume either they didn't get the muscle aches or they were convinced they weren't due to the statin. And it's made me think a bit, because very often in practice, I will say, when we re-challenge with the statin, we could re-challenge with a lower dose because we know that muscle aches are more common with a higher strength, a higher dose of statin. And it's just made me think, I think that's still the right thing to do, but is it the right thing to do because they're less likely to get muscle aches because it's a lower dose? Or by giving them a lower dose and saying to them, this is less likely to give you muscle aches, am I reducing the nocebo effect because they feel less inclined to think this tablet's going to cause them muscle aches? Fascinating. It's not going to change my practice, other than I think I'll really stress that it's less likely to cause you muscle aches, because that actually might make them less likely to get muscle aches. I love the way the brain works. I think the placebo effect and the nocebo effect are absolutely fascinating. We are not robots or computers where if you put the same input in, you always get the same output out. We're fascinating, complex human beings with how our brains and our bodies work together, and I will never cease to be interested. So I hope you found both of those interesting and helpful. If you've been affected by health anxiety, I'd love to see what you found helpful or how much you relate to Maya's case, or if there are other issues that affect you. I'd always love to hear if you've got ideas for other case studies to do in this series. And as always, if you've found this helpful, then if you could like and subscribe, that would be a really great thing. That would do me a great favor. See you next time.